right, we've got on set with us already Mr. Hussein Uselu is the President Rotary Club of Benin. Good morning.
Good morning.
Okay, and Mr. Jonathan is the President Rotary Club of Uselu. Good morning to you.
Thank you very much.
All right, so let me start off with Mr. Hussein. Rotary Club is on a mission to bring polio to zero, all right, according to you. Now, why are you on this campaign, really?
Yes, we're on this campaign because polio is a very deadly disease in the world. Okay. And Rotary has taken it upon himself over 35 years ago to join the fight against polio.
Okay.
And polio, for now, in 2020, Nigeria was certified polio-free.
Yeah.
But we want to keep it at zero. We know Nigeria is polio-free today, but want to maintain that figure at zero. Okay. In the world right now, we still have two countries who are still battling polio, which are Afghanistan and Pakistan. And because we know that the world is a global village, people travel here and there. Yeah. People could come from Afghanistan, from Pakistan. So such infection could still come into our country. So Rotary Club of Benin and other Rotary clubs in the country is coming out to advocate and enlighten the public about taking the polio vaccine for every kids below 5 and below. We want to make sure that every kids out there go out and take the vaccine so that they are free from polio.
Okay. Well, so let me join Mr. Jonathan now, President of Rotary Club Uselu. Really, at the grassroots level, you agree that there are a lot of parents out there who are not still, at home, with especially accommodating those who want to really give this vaccine. What efforts is your organization doing to ensure that that is not the case?
It's okay. Rotary Club of Uselu, in collaboration with other Rotary clubs in Benin and worldwide, we are trying to see how we can reach out, to everyone in the nooks and crannies of the country to see that this particular problem is eradicated. I, for example, happens to be a victim of this problem we are talking about, polio, very long ago. But because of the remote area that my parents were working as at that time, I got infected, and they didn't know that this was actually the problem. So we felt it's very pertinent, to carry out this sensitization, to reach out to people so that they will be aware that this disease is still very much among us. Like you rightly said, my co-president rightly said, people travel all over the world. And in the process of traveling, this disease is being infected and they transfer it to other parts of the world. So we cannot really say that the disease has been eliminated outrightly. Okay, let's take, for example, areas where you have challenges like security challenges. The people who attempts to, what do you call it now?
Who are administering the vaccine?
Administration of vaccines cannot easily get to those areas where you have challenges. So you see that when people are infected there, what happens? Disease tends to spread. So these are the things we are trying to say that all these areas where we have challenges, we should teach the medical, the fighters on how to administer these vaccines to people that live within those vicinities. If ordinarily the medical personnel cannot access these areas. So we are here today to sensitize the people that there will be need for every child in this country from 5 years below to be immunized.
All right, Mr. Hussein, so when exactly is this campaign kickstarting?
The campaign has started now, but the World Polio Celebration Day is 24th of October. And on the 24th of October, our district, which is District 9141 for Rotary, is hosting the other districts in the country. And this program is going to come up in Bayelsa. So all Rotarians will go to Bayelsa, and there we're going to have a massive publicity and sensitization. But before that day, we our club and other clubs in Benin have already started this publicity and sensitization, and also awareness and assistance to some of the health facilities which are around our vicinity. For example, those health facilities, we are visiting them to give them polio vaccines. We give them other materials which they might require in their health environment.
Oh, okay, so that will just help them to give free administration of the vaccine to those who need them.
Yeah.
Okay. All right, so it started already. I want to say a big thank you to Mr. Hussein. But then just before I let you go, is there any requirements apart from the so-called ad hoc health personnel that will need, that this facility you talked about to be given? Are there other persons that can take advantage and be part of what you're doing, what you're about to do, brother?
What we are doing right now is advocacy. For anybody who wants to join Rotary to pass this message, they are very welcome. But we want to let the people know the sensitization message we are sending is to parents to take your newborn, your newly born, your kids who are between ages of 1 to 5, take them to any health facilities, hospitals, healthcare centers to make sure that they are vaccinated.
Okay. All right. All right, so you heard from Mr. Hussein Uselu, and then, of course, yes, he's the president of Rotary Club of Benin, and Mr. Jonathan is the president of Rotary Club of Uselu. Thank you so much for joining us this morning.
Thank you very much.
Thank you very much.